Hello, we are Team Relila, and our innovative 3-in-1 pad is designed to discreetly provide new mothers hospital-level care at home. We are Lauren, Alexa, Caroline, Alisa, and Alexander, and we've been working with our corporate sponsor to expand their current offerings in the maternity space. Here's the everlasting problem. 85% of women experience some degree of vaginal laceration after birth, and current market offerings are not able to continue that hospital-level care at home. The consumer we are trying to reach is a millennial woman with an income greater than $42,000 who has experienced perennial lacerations as a result of birth. We hope to offer her an easy product that provides her with the proper care without sacrificing body positivity or adds any more burdens in this incredibly stressful time.
Our pad combines three key vaginal postpartum care needs into a single product. Through the application of biomaterial technology, we're able to bring new mothers an all-encompassing postpartum pad that delivers reliable, on-the-spot soothing and relief to aid in speedy recovery. We followed a multi-step design process, focusing on each component individually. To develop our super-absorbent polymer layer, we did an extensive literature review, tested candidates, and chose sodium polyacrylate based on its compatibility with our needs. Incorporation of witch hazel in our product was driven largely by conversations with medical professionals and enabled by the electrospinning technology available through the Burdick lab. Development of the ice pack involved literature review, testing, and selection based on the predetermined criteria. All of these components were brought together in the product design process, which synthesized information gained through market research, conversations with medical professionals, and our own ideas. We conducted rigorous testing for all components before incorporating them into the final product. Target values were guided by literature review, conversations with medical professionals, and market research. These criteria informed material selection and provided quantitative metrics against which we could track product performance. Shown here is a cross-section of the multi-layered Relila pad. Working from top to bottom, we see 100% organic cotton, electrospun witch hazel mats, the superabsorbent polymer, and an ice pack utilizing ammonium chloride. This is all reinforced by a low-density polyethylene barrier, which seals the layers and prevents leakage. This spring, we focused on improving the electrospun mat we created in the fall. We then prioritized ice pack development. This involves testing multiple salts and selecting the best reaction for our needs. Finally, we emphasized product design. With the individual components complete, we created an innovative form factor based on conversations with clinicians and customer feedback.
The first point of testing we undertook was to determine which polymer we wanted to utilize in our final product. Ultimately, using the teabag method, which was the method to measure water absorbed by a superabsorbent polymer over time, we found sodium polyacrylate to be the most effective one tested and used this in our final product. The second component of the pad we worked on was constructing electrospun witch hazel mats. This involved two main objectives. The last semester, we worked on testing the functional equivalence of witch hazel pre- and post-hydration, and this semester we worked on electrospinning mats with witch hazel in them and characterizing the release profiles of them. As discussed last semester, we tested the functional equivalence between store-bought leaf and bark powder solutions. We could not use store-bought witch hazel as it was dissolved in ethanol and couldn't be used in the electrospinning process, so had to construct an alternative. As you can see in the graph, we found two main results. One, which was a peak at 280 nanometers. And two, using the store-bought solution as a standard peak, we found the bark was most similar, so determined it would be best to incorporate that into our final design. This semester, we continued to move forward in constructing the electrospun witch hazel mats. We dissolved polyethylene oxide, or PEO, a common biocompatible material, in our bark powder solution in the Burdick lab, and were able to successfully electrospin multiple mats. With these mats, we were able to conduct a variety of tests to examine the release profile of witch hazel over time. The setup of our main experiment was as follows. We placed a piece of the mat into a cuvette of water, and as the mat dissolved in the water, we measured the absorbance over time of that solution at 280 nanometers. The main result found is shown in the graph to the left. We found that the release of witch hazel from the mat was very quick and plateaued around 30 minutes, which fit our desired specifications. The last component we worked on this semester was designing and executing making a crackable cooling pack. The final design of our cooling pack is shown on the left. It's composed of two concentric plastic bags, the first one filled with water and air inside a second bag filled with our chosen salt. A comprehensive literature review revealed that ammonium chloride was the ideal salt to use in our design. To test which combination of salt and water would be able to sustain the lowest temperature for the longest period of time, We varied the volume of water mixed with 100 grams of ammonium chloride and, as shown in the graph to the left, found that the ratio of 100 grams of ammonium chloride to 50 milliliters of water outperformed all the other combinations we tested.
We believe there is immense opportunity in the postpartum care space. Certain cultural changes, such as the fast-paced environment of developed countries, a growing concern for and awareness of women's health, and a higher tendency of women to work during pregnancy, have produced a growth in the maternity space. Currently, the market segments are primarily composed of maternity apparel, skincare, and vitamins, all of which are focused on during pregnancy products. However, we see a large gap in postpartum product offerings. Our corporate sponsor focuses on upper-income millennial females and is currently dominating in the organic feminine care space. Based on this market analysis, we believe that our corporate partner has potential to capture up to 500,000 women. We've analyzed and tested competitor products to determine what the current gold standard was and to fully understand what components were necessary to include in our final design. We determined these 5 dimensions as particularly important for our final product. While there are products that tackle individual components, there is no pre-existing product that tackles all simultaneously. Our corporate sponsor is a direct-to-consumer business that specializes in subscription packages for women's health products. As such, we believe leveraging their existing structure would be the best fit for generating revenue. Our partner currently uses subscription fees to generate recurring monthly or weekly payments for regular deliveries. While the life cycle of a new mother's subscription may be shorter than a typical customer, it will certainly result in an increase of revenue. Another market we believe our partner could enter is selling via subscription to hospitals and healthcare professionals to replace existing methods and streamline nurse pericare. This would also introduce the product to mothers early and could result in an increase in purchases and usage at home. FDA approval of this product could be a new realm for this company, and they would be responsible for undergoing the proper approval process, which may cause them to incur some sunk costs. However, all parts of the pad, except for the witch hazel mats, are pre-approved, so it should not be too burdensome for the company. With regard to cost of the pad itself, all the components are extremely inexpensive and highly accessible, resulting in a total cost per pad of $7.89, which is cheaper than our corporate partners' existing pads.
Moving forward for the rest of the semester, we will be focusing our efforts on continuing to collect consumer feedback, transitioning our project into the hands of our corporate partner, and presenting at the M&T Summit. We've had some challenges so far in finding eligible participants from our corporate sponsors' customer base to interview. We plan to send out a second wave of emails to our sponsors' customer base in an attempt to reach more participants. After completing the consumer feedback sessions, we will then focus on thoroughly documenting our work to ensure a smooth handoff to our corporate partner. Finally, we will be completing our presentation and presenting for the M&T Summit.